Great. So good morning. This week, we want to provide you with further updates on our testing program, thinking through some ways to hopefully streamline the process for you, address some of the staffing issues that we know you're facing across the state, and then to look ahead to some of the issues related to our mask requirement, as well as close contacts. So a few different topics to cover today. As always, our team is with you here today from the Department of Elementary and Secondary Education, from the Shaw Foundation, and from the COVID-19 Command Center. We're also very pleased that most of the CIC team and many of our program coordinators are also with us today. We all just want to stay connected, make sure that we're very tight in our communications and tight in our support for you, the districts, the schools and districts that we are serving. The topics that we have for today, like I said, we want to talk about some of those staffing constraints and some ways to help to alleviate them. The extension of the mask requirement and reminders on close contacts. Just a quick review on the Shaw Family Foundation resources, and I hope you'll all stick around for next steps in terms of just looking ahead to next week as well. Thinking about this challenge of staffing constraints, we have appreciated hearing from you and staying close to the data that show us where we continue to have some staffing constraints. And so we just want to continue to acknowledge that we know that some of the staffing support has been slow to materialize. We are working day and night to address this, and we will work until it is fully addressed. We are continuing to try to come up with creative ways, innovative ways to make sure that we address this staffing shortage and get you the supports that you need. We are tracking this closely so that we know who's starting, who needs more support, what type of support, and really appreciate CIC's commitment, particularly to double the number of subcontractors. Previously our goal had been to have the current subcontractors add more staff. They've been great partners. They've done their due diligence to try to find staff. But they've even said to us, we think you need more subcontractors. And so CIC has listened closely to that and is aggressively working to double the number of subcontractors. They're on their way. We have new subcontractors that are being onboarded actively right now that will help to add to the number, our capacity to add staff quickly. So we hope to introduce more of you who are waiting to new vendors who we know will be able to get you the supports that you need. So just want to remind you that we're taking kind of a two-pronged approach to supporting you. First, we don't want you to wait if you are struggling with your program to launch your program. As always, just reach out to the email address that you see on your screen there, the K-12 COVID-19 testing at mass.gov. We don't want you to get to that boiling point, that frustration point, if we can avoid it. So please let us know what your experiences are and what you need. We want to respond and get you the support that you need. In addition, in a more proactive way, CIC leadership is proactively reaching out to every participating school and district during this week. And so hopefully many of you have already spoken to a representative from CIC. They're using their highest levels of leadership to do this, to have these conversations with you. Because we want to make sure that we are putting the full picture together. We can see on paper if for example, program coordinators are assigned, but the story sometimes is deeper than that around what are the hurdles to getting the program fully launched. So we want to make sure that we're lifting our information off of the page, hearing from you directly, working to problem solve, and we are just in constant communication between CIC, DESE, and the COVID Command Center to make sure that we are hearing these concerns and working very diligently to get them addressed. So that's sort of where we are right now, big picture, to address these staffing shortages. But there are some additional staffing solutions that I just want to mention to you today. And so we've talked a little bit in the past, this isn't brand new information, about perhaps you as district leaders helping to connect some other school affiliated staff members, maybe after school program staff, to the subcontractor who's assigned to you so that they can get signed on to be paid through our statewide system. And what I really want to clarify today, not only as you're thinking about, like we've given that example of after school program staff, there might just be other people in your school community, it could be parents. But what we really want to clarify today, and that I hope might sort of broaden everyone's thinking about these staffing solutions and who might be available to support us, is that the people involved in doing certain aspects of this program do not have to be healthcare providers. And so anyone involved will definitely receive the training, the materials that they need to administer the test. But there are functions, critical functions to making this program work that do not have to be provided by healthcare providers. And we really appreciate that the staffing firms that we've worked with are healthcare organizations. We think that's an important foundation, but we can certainly expand beyond that. So if you know of a staffing firm that doesn't solely have a healthcare orientation, please let us know. We'd want to try to sign them up as a subcontractor. If you know individuals who might have the time, who might have some of the expertise needed to come in and help administer the program, to observe the collection of the samples, to support, the materials collection and, assembling to get them ready for the courier. Please don't hesitate to reach out to that individual. We can add individuals as subcontractors, and we can add organizations as subcontractors. Both are so important. And so, we have different avenues. You can go to your program coordinator. Again, we're glad to help facilitate as well. We are really motivated to make these staffing solutions work. So if you even have, just a foggy idea that you want to run by us, reach out to the COVID, the K-12 COVID testing email address, let us know. But here's what we want to do today to even further ease this process or facilitate the process. We've created some sample job descriptions in combination with CIC, because when we're talking about this, when we're saying to you, hey, if you know anyone at the community level who might be able to help, we thought it might be useful for you just to have some job descriptions to say, this is actually what we're looking for. There are kind of 3 different types of positions that could be, needed on site for you: the project coordinator, the sample collector, and the site observer. So we've developed job descriptions for each. Lauren is putting them in the chat as Word documents. So, you could download them if, that way when you're talking to someone, you're thinking, does this person have the expertise to be a site observer? You can know what are the qualifications that are necessary. Because again, this is new work for all of us. None of us went into public education thinking we were going to be talking about sample collectors and site observers. And so, we know what it often takes to be a teacher, to be a paraprofessional, to be a school nurse. These are positions that we hire for regularly. These positions are different. And so we thought that it would be important to bring you the information about what types of requirements are necessary. What are those kind of minimal the minimal requirements that would get somebody in the door to get them trained and hopefully up and running. So we hope that you will use these sample job descriptions as necessary, as appropriate. We're going to keep at it. It's not like we're putting this on you to say that you have to do this, but we're saying if it helps. I know that I've had some problem solving conversations with districts this week where I've said, if you think a little more broadly, are there people within your community who you might be able to identify and, get sort of the juices flowing in the problem solving. And if we can do this together, I think we're going to get further. And so we hope that these sample job descriptions will help you. And if you have any feedback on them, please let us know. The other thing that, if you were to put in the chat to Lauren, as Lauren is the host, if you have any feedback for us on any other materials that would be useful in getting the word out locally that there are these positions available, we would love to hear your suggestions. We will follow up. We can create, brochures, flyers, whatever it is that you think might be helpful. We would just be glad to kind of calibrate and hear what's useful, what's not, because we don't want to, flood you with more written materials unless they're really going to be useful to you. So if you have an idea of what we could provide to you that would be even more useful than these sample job descriptions, please let us know. We want to make sure that we are helping to create these connections and get our staff, get staff into schools to support these programs. Another idea that we have for staffing options is just that reminder that you could also apply for FEMA reimbursement for staff that you are adding on, right? Not existing staff, but staff who you are adding on to implement this program, to implement testing in your schools. As you're adding those individuals, their costs could be covered through FEMA reimbursement. And as we've mentioned before, this is the email address to go to. And there are other types of support from FEMA, other types of reimbursement, and of course, we're continuing to work on our reimbursement as well. And like I mentioned, in terms of problem solving and brainstorming, there also exists in Massachusetts what's called the Medical Reserve Corps. And so these are, in many cases, sometimes, otherwise part-time medical providers in the state. They are sometimes retired medical providers, doctors, nurses, you name it, who have a medical background, and they can be tapped to come in and provide temporary help. And so we understand that there are about 200 medical reserve corps across the state. And so CIC has been in touch, as has our own. We've made connection through DPH, where this program is run through, to try to make some connections and try to further mobilize the Medical Reserve Corps. But if you know of the existence of the Medical Reserve Corps in your community, that could be a group to go to see if they could help you temporarily. And we're glad to further make connections there. And like we have mentioned here, that CIC is also helping with that outreach. So just different avenues to think about right now, while we continue to work really diligently to expand the number of staff available through our subcontractors. So we hope that some of these ideas stick. The more that we're doing, the further we're going to get. Another idea that we have for some districts, not all, but some, to kind of address the the time that it's taking to complete particularly pooled testing, and then the staffing demand that comes with that additional time, is to consider using a single swab pooled test instead of the double swab. So when we announced this in the summer, we were really pleased to give you several options related to pooled testing. One is the idea of double swabbing, where for every time we collect samples from a student, we're collecting two from every sample. One goes into the pooled tube, the pooled vial, and one is kept separate, so that if a pool comes back positive, we can just quickly use the individual samples to determine who from within that pool was positive. The challenge with that is that it takes time to separate out that individual and label that, that individual swab in a vial separate from the pooled collection. And that time, we're hearing, is adding up. And it's, if you have a limited number of staff members, we're hearing, getting through a building quickly enough. And so we're suggesting, not requiring, but if you are using double swab and you're struggling with having enough staff to do it adequately, at least on a temporary basis, you might consider switching over to single swab, where we do the follow-up testing with Binax Now in the schools. And the thing that's happened since we announced this in the summer is that now that we have Test and Stay up and running, you're doing a lot of Binax Now. It's a common theme between symptomatic testing and Test and Stay. A lot of you are already very operational with Test and Stay and symptomatic testing, which is great. And so the idea of doing some more Binax Now, some schools are finding it's actually okay, because there's a lot of muscle there to make Binax Now administration work. And so switching to single swab and using Binax Now as follow-up testing isn't quite as heavy of a lift, because you've already got so much going with Binax Now. So it's something to think about if it would help to kind of streamline the process for you for right now. We're glad to engage in that conversation with you. You would talk to your program coordinator to get that switch to happen. It's the same lab, so it wouldn't be a big deal to go from double to single, and then maybe down the road back to double. But that could also help to streamline the process. Another update in the way of streamlining, and Jeremiah, I might have you jump in here because I'm less familiar with this, and so if there's more that we need to say about it, just please chime in. But a challenge that we heard from you was about bulk entering the Binax Now results into Crush the Curve. And so really pleased that CIC has worked to create this ability for you to upload bulk results. And you can record all the negatives at once, which, predominantly you're getting those negative results. So you can upload them all at once, at the close of the day of the testing. The results then get emailed out to the email on file for that individual. So whoever is meant to be notified will be notified, and they're also reported in Maven. The last thing that I'll say is CIC has developed an explanatory video, and we've included a link on this slide so that if you want to watch a video that will help you kind of know how to navigate Crush the Curve for this bulk upload, just please use that video. It's short. David Berlin narrates it, so really clear. If I could understand it, I think you'll do fine. And really glad that we have this ability lined up for you. Jeremiah, anything that you want to chime in there, and anything that I missed about any of that I just talked about? Jeremiah, you're on mute, my friend.
Thank you. Sorry, I couldn't come off. Yes, just one brief thing on this. Oh, come on, now I've forgotten it. I think this is a good example of there are basically two fundamental ways in which we're attacking this this staffing situation. And one is just as many of the right people that we can get in as fast as we can possibly get them. And the other one is how much each person has to do. And so this was an example of an idea that we had with CIC where, we're using people's time reporting results one after another. And so I can imagine folks deciding that they either are not going to do them in certain cases, which we don't want, or they're taking time to do that instead of doing the rest of their job, or instead of administering another test, which we also don't want. So I say this only to highlight that if you have other ideas, not only in terms of staffing, but also in terms of the things that are really bogging you down as you look to implement this program that seem like there might be a better way around it, even if you just identify those things and you don't have a better way, please let us know. But if you do have a better way, definitely let us know. Thanks, Russell.
Great. Thanks, Jeremiah. So we continue to look for these time-saving solutions, these staff-saving solutions. So your feedback is helping us with solutions like this, so keep it coming. Great. Thank you. So that's it for updates on our testing program for this week. I want to shift now to talking more about the information that we've shared most recently from the department about the extension of our mask requirement and some key reminders about close contacts. So just a quick reminder about the extension of the mask mandate, the mask requirement. So our board voted to extend the mask requirement. It was originally in place through at least October 1st. And now we've extended it through at least November 1st, as I know you know. But if you're looking for any more information on this, we certainly get questions about where's the information on DESE's website. We thought having this link here for you would be useful. And so where you need to go to get the information to explain it. Just a couple of quick reminders about what remains in effect with the extension of the requirement. So keep in mind that, students ages 5 and above are required to wear masks indoors when in schools, with few exceptions, and visitors are also expected to wear masks in school buildings. Like I said, the requirement will remain in place until at least November 1st, and we'll revisit the requirement during the month of October to determine what is warranted in terms of future direction here based on public health data. Just that reminder that masks need to cover the individual's mouth and nose. If anyone from my son's school is listening, they are welcome to go tap them on the shoulder and remind him to cover up that nose, because I know it's not his strong suit. So feel free to send that reminder. We will also recommend that students younger than 5 continue to wear a mask. This is really important. We do get a lot of questions about students and staff who can't wear a mask for medical reasons or behavioral reasons. They are exempted. And I do know that I was clarifying this week with our problem resolution team here at DESE that we don't have to have a note for allowing this exemption. So there are some times where, there's a question as to whether or not a student should be exempted. Maybe, the team hadn't seen this as an issue in the past, and so they do want to ask for that medical note. You can certainly do that. You have the discretion to ask. But we also know that there are situations and there are students where the team knows the student well enough, the teachers, the staff know the student well enough to know that it's definitely not appropriate, not an expectation that's reasonable, not a reasonable expectation for a student to wear a mask. And we're not going to ask those families to have to, go to a doctor to get a note if it's just clear that, for those, medical reasons, for those behavioral reasons that the student can't wear a mask. families don't have to go get a note. But if there's a question, you can ask for it. It's your discretion. And so we hope that's helpful as you continue to deal with that going forward. Mask breaks can continue to occur. And, particularly if feasible when windows are open and the students are outdoors. And then masks can be removed indoors to participate in elective classes, such as, using wind instruments and band. We've had a lot of questions about sports, buses, and discipline. So just a few quick reminders on those three topics. We do require masks for sports-related activity for student athletes and coaches when indoors. And that we do have a federal health order that requires students to wear masks on school transportation. So when they're riding the bus, they need to continue to wear masks. And even though the weather's getting a little cooler, and we certainly felt it this morning here in Massachusetts, we ask that we keep that window open as much as we can on the bus. And probably a good time of year to be reminding families to encourage their children to wear more layers of outerwear on the bus because it is going to get cooler. We all know that. So we do get questions about if a student won't wear a mask and is refusing to wear a mask, when discipline should come in. This is where your local discipline policy matters. So we want to make sure that you're providing due process, that you are thinking about, before sort of jumping to discipline, thinking about how can you work with families, how can you work with students to, support them in ultimately wearing masks in schools, particularly if it's just a matter of a refusal as opposed to a discipline or medical issue. But if there is to be any kind of consequence, that written notice would be really important, and the use of progressive discipline, just like I mentioned. And so, and then just a reminder further about, I think I've talked enough about students with that exemption for medical conditions or behavioral needs. So again, I hope that's helpful in terms of just a quick reminder on where we are on the masks in schools. Let's talk a little bit about the vaccine and the vaccine rate threshold, because that we've put out there that if a school demonstrates a vaccination rate of 80% or more of all students and staff in the school, right? So it's students and staff. When you think about the numerator being how close are you to that 80% and the denominator being, you've really got to have that careful accounting of all students and staff, that you would do it through an attestation form submitted to us. And we have a link here for you. We appreciate the questions we've been getting about, the 80% and schools that think they're, have any questions about submitting the attestation. Here's an important thing about the attestation. The attestation allows us then to look into your unique circumstances further as necessary, if appropriate. We really can't tell you in advance whether or not you are definitely, likely to get our approval of your attestation to allow students who are vaccinated to remove their masks if you've hit that 80% threshold. So, we ask that we're certainly glad to answer any clarifying questions that you have. I know Rob Curtin is here with us today and appreciate Rob's time. Rob is the person to go to as you have questions, and I think a lot of you have already reached out to him. So just keep in mind that we will answer questions about, just the attestation form itself. How do you count? Who do you count? But in particular, have you reached the 80% threshold is something that we can sort of determine once we get your attestation. The other thing that I'll just mention quickly about this is that, we want to make sure that unvaccinated staff and students would continue to wear a mask, even if you get to that 80%. And we will continue to work with our medical experts to think about any additional metrics that would be needed down the road, right? Because we've been asked a lot about the ultimate off-ramp for mask wearing. And so what might come further down the road is just still, we are constantly talking with medical experts about how to think about this in the future. So any future development around masks and any additional metrics would be down the road. Right now, we're just really focusing on using the vaccine rate threshold as the metric right now. We've had a lot of private schools that have reached out to us about this. Keep in mind, this doesn't apply to private schools. And we know we have a lot of private schools in our meeting right now. Welcome, we're really glad you're here. But keep in mind that this vaccine rate threshold And the determination, anything about the mask requirement only applies to public schools, it applies to charter schools, it applies to approved special education schools, education collaboratives, but not private independent schools. And so you don't need to send us an attestation. You get to make your own decision about mask wearing. We do not have sort of oversight or jurisdiction over that with you or for you. So I know we'll be glad to take any questions that you have about the vaccine rate threshold. Let me just move as my final topic for today, near final topic, I promise, is just the update about identifying close contacts in schools. We sent out information to superintendents and executive directors last week, just with that reminder about who is a close contact. And so as you can see in the, information at the top of this slide that has, that's circled, that we always want to just keep that as a mantra: individuals who've been within 6 feet of a COVID-19 positive individuals while indoors for at least 15 minutes during a 24-hour period. And I know that, I kind of say that to myself like a mantra, because I'm asked a lot about, does this count as a close contact? And I can't say this enough. The definition of a close contact has not changed. This remains the same definition. It's what we have to do as a result that has evolved, right? That we see there have been some good medical evidence, some good research that's helped us to know what we need to do with our close contacts, but the definition of the close contact itself has not changed. So just a few other quick details about that. The exposure time begins 48 hours prior to symptom onset. So, and it continues until the time that the COVID-19 individual is isolated. So there does need to always be that kind of timing of, when did the student get or staff member test positive, and then looking back for that 48 hours prior to symptom onset to determine who were the close contacts when they were at that point of symptom of 48 hours prior to symptom onset. Multiple brief interactions are unlikely to result in 15 minutes of cumulative exposure and don't meet the definition of close contact. There is obviously some judgment call there about how transitory an interaction is, but just keep in mind that those really brief interactions don't count. And I can't say enough that that definition specifies time indoors only. So exposures outdoors do not count towards the 15 minutes. They do not count towards the identification of close contacts. And, I think that last bullet really sums that up nicely. So I think what I would really encourage you to do, if you haven't done so already, is almost memorize who are the exemptions to quarantining as a result of being a close contact, because these exemptions matter a lot. So again, if you are asymptomatic and fully vaccinated and you're identified as a close contact, you don't need to quarantine. If you are a close contact who is spaced at least 3 feet apart, so once you're at 3 feet or more, right? So if you were exposed, you were within 6 feet, but you don't need to quarantine if you were more than 3 feet apart. Bus close contacts also do not need to quarantine, and close contacts who've had COVID-19 within the last 90 days. So we do ask that you really think about continuing to work to identify who close contacts are, so that we aren't ending up needing to determine that a whole class is a close contact. We want to minimize that and really look to see who were the genuine close contacts in any situation. And the decision tree that we linked to here could really help you correctly identify those close contacts. Lauren, is there anything more that we want to add about close contacts at this time?
We are just getting the question of the notification to families about being a close contact, and we have provided letters on our website that 2 types of letters for close contacts. One, identifying that an individual is a close contact, but that they don't need to quarantine or participate in any testing protocols. And then a second letter that says you are a close contact and now you need to participate in testing or in quarantine if they have not consented to testing. And so we have 2 types of notification. And we do get the question often, Russell, if a district is required to notify that an individual is a close contact. And we certainly recommend it, but that is a local decision that you can determine when it's appropriate to notify your families that they're close contact.
Great. So Lauren, I know that I'm also seeing a question in my chat about this, that if you are unmasked and on the bus, which actually shouldn't happen because you should be masked on the bus. But if there is a situation, if you are unmasked on the bus, is there any further guidance on that? I don't think we've delved into that level of detail, because we assume that all students are masked, and then, you know, from a special ed perspective, students who with disabilities who can't wear a mask on transportation should have some reasonable distancing on the vans, on the buses. So hopefully that would actually reduce any need to identify those individuals as close contacts. But we do hope that that's really not a situation that would be occurring a lot. Anything that you'd want to add on that?
Yeah, I think that's right, Russell. And then actually we have Anne-Marie Stronach on the line on our webinar too. And so I'm just going to ask if Anne-Marie has anything else to add to that.
Thank you, Lauren. I appreciate that. I would say that if an individual was on the bus and wasn't able to distance, then they should, with unmasked, I do believe that they should be close contacting those individuals. But as Russell said, that should be a very, very rare occasion that is happening. And I would encourage your school district to remind parents that they are required to wear masks on the bus at all times, and that is a federal requirement that may be helpful in solving that problem.
Thanks, Anne-Marie. Deeply appreciate it. Thanks, Lauren. So as we kind of wrap things up, I just always want to remind you of Shaw Family Foundation resources. I showed this to you last time, but those cheat sheets that we have links to for keeping track of usernames and passwords for the type of software platforms that you might be using, like Crush the Curve, Veritas Genetics, and Project Beacon, we hope will be useful to you. So huge shout out to the Shaw team for all of their support for implementing our statewide testing program. So hopefully you'll find this information useful as well. Few next steps. As always, we just want to remind you where information is on our website. So if anything about our COVID-19 testing program, and really importantly, the FAQ for our testing program is on our testing program webpage. I know I get this question a lot. Where can I find that FAQ? It's on the webpage, or on the testing webpage. On the desktop page is where you can find the extension of the mask mandate, and anything about the threshold and attestation form. If you're looking for the form itself, it's on the desktop page. And then our general FAQs are on our FAQ page, and we always let you know when we update it through the Commissioner's Weekly Update, which is also how we identify upcoming webinars as well, in addition to emailing anybody who's participated in these meetings directly. So just a reminder, if you haven't signed up yet and you're still looking to get started, feel free to complete our authorized school application and statement of assurances. And if you need to order our forms through CIC, if you need to order, Buy Next Now or eMed, the at-home Buy Next Now, we've included the order forms for you there as well. Just a reminder about needing who to contact if you need help. Always start with your program coordinator. Feel free then to go to CIC directly. And then if you still don't have what you need, always feel free to email us here at DESE or the Shaw Foundation. And we're glad to just, be in touch as soon as possible. We don't want you to get overly frustrated. Come to us as quickly as you can. We want to support you. The final thing that I'll just mention is that next week, something to tune into that we are likely to announce is how we can involve out of school time programs in Test and Stay. Had a lot of questions about this, a lot of advocacy around this from you saying, hey, this is really putting a stress on families. If they can stay in school when they're identified as a close contact in school and can do Test and Stay, they can stay in school, but they then can't go to the after school program or the before school program. That's just a huge stressor for families. Is there anything that can be done about that? We've worked really diligently with our colleagues in the Executive Office of Health and Human Services, with DPH, and of course, our colleagues in Early Education and Care, EEC. It is likely that we will announce how some OST programs, not all, but some, particularly if they are EEC affiliated, because they would be following the same requirements that we have in schools, the same kind of safety requirements, that there will be some OST programs for whom we can extend the coverage, frankly, of test and stay. We would likely announce another webinar for next week on Monday. Again, likely is the operative word there, because we need to make sure everything comes together. And if we do announce this next week, if there is a webinar, you might consider having your OST program coordinator join you, particularly for any EEC affiliated OST program. It might be a good thing for you to listen to together, so that you're sharing information and determining next steps. There are some steps that have to be taken to implement this. And so we just want to make sure that we're clear with both parties, OST program coordinators and district leaders, about how to pull these pieces together. So that's it for content for today. I will stop my share, and Lauren, glad to see what questions people have.
Thanks, Russell. So the first question is always, will the slides be shared? And I'm going to put them into the webinar, into the chat right now. So everybody should have them. We always like to make sure we get through the content before we send the slides. So there you go. So Russell, our first question is about, should schools be sending individual results of individuals participating in test and stay to families?
Lauren, I believe the answer is yes, because if you're Binex now, we do want families to know the result. They should get that automatically through the system, right? If they're signed up through the software platform, the results should just go to them automatically. So it really shouldn't be a lot of work. I know that, you know, we do recommend the additional follow-up, of course, if a student is positive, you know, there's more that needs to be done, but I wonder if you have any further suggestions on that, or anyone else from our team.
Nope, I think that's, it's definitely recommended, and you could work with your project coordinator in order to operationalize it. Great. So there was a question about in hiring, and I apologize, my video is not working right now, but I am here, obviously. There's a question about, can school nurses be hired by CIC if they're working outside of school hours?
It's an interesting question. It's really key that anything has to be outside of school hours. We definitely can't double dip. And I don't, you know, David, I see you're here. I don't know if you have any thoughts on that, or anyone else from CIC to add here, but I mean, we definitely want to, I think we would be glad to consider it further. David, please.
I think can speak for the CIC team. The priority is just getting as many on-site staff and qualified individuals as you need. And as Russell mentioned, we're working so hard with Shaw, with DESE, with EOHHS, and with all of y'all to make sure that happens. I think if you have nurses and if you have staff professionals, or you have volunteers who are dedicating their time to this, we want to make sure that we can recognize them for that time. So if there are nurses that have time after hours to be able to do this work, if it's manual entry of Binex Now results for that day, etc., I think that's definitely something we're on board with, as long as y'all approve.
And David, can you actually stay on, because there are some questions about how does the training occur for the individuals that are hired by your subcontractors?
Yeah, of course. I think, I'm not sure who else from CIC might be on, but my presumption is that if you're already up and running, then you already are trained. This is something you already do, but we have daily stand-ups for the PCs, and we can also create a training for, or we can train all new individuals, part of like weekly cohorts if necessary.
Great.
But my guess is, at least for the parents, for the nurses, and for the people who are actively doing testing, it's different if you want to bring on a different agency, but that you on the ground sometimes have the most experience with COVID testing.
Great. Jeremiah, is there anything else to add to that?
No, I would just say David does a lot, but he is not the person that holds the keys to training the folks that are on the ground at school. So if folks would like a more formal response to that, please just let us know. Thank you, David. Thanks, Lauren.
This is Tim Rowe. I was just going to add one more comment. I wasn't able to unmute before, but thank you, Lauren. So essentially what happens is when you do this, you would become technically an employee of that staffing services firm, whether that's a firm like Adecco or Judge or Meet Caregivers. They're paying you, but they're also responsible for training you just like they do their own people. So each firm would use its own processes that it uses now with regard to that.
Great, thanks, Tim. Okay, so there's a question, Russell, about, and Jeremiah, maybe you're best positioned to answer this, but self-swabbing. Could you just review when you can self-swab and when you cannot self-swab?
Yes, I can. And there's a little nuance here. So shocker, I'm sure, for everybody. So for all of the pooled tests, you can self-swab. For all individual PCRs that you're doing, you can self-swab, and that's down to kindergarten inclusive. In both circumstances, you're going to have students who are either not going to be able to self-swab or they don't want to self-swab, and that's okay. These swabs can then either be, I guess they can be administered by CIC staff or by school staff as you see fit. The exception here is the Binax Now. So on the Binax Now, right now we're in a place where the Binax Now test has to be third-party administered by somebody who's been trained to administer Binax Now. And that I know is a time-consuming manual process. And what I would say on this is that we are aware that that is a time-consuming manual process, and we are looking at ways that we can address that.
Great. Great. And then Russell, can you just review the masking requirements when you're involved in test and stay, particularly for sports?
Yeah, so we do ask that it's actually a requirement that if you're involved in any school-based anything you're doing on the school grounds, you need to be masked. And so the masking is indoors and outdoors, and it would be for during the school day and for sports, any school-related extracurricular, because we want the student to, like, our goal here is to maintain participation, maintain attendance, maintain learning. Really important, but we want to do it safely. And so while that student, has been exposed and there's some risk involved for that student, right, to actually contract COVID-19, we just need to take that extra step and make sure that the individual is masked all times while in school. And so, Laura, I don't know if there's anything more you want to add there, but it's really just making sure that we're sort of saying we're allowing you the right, we're affording you this opportunity to stay in school. We think it's really important to do so, but you have a responsibility to then wear that mask to make sure that we're just not, we're doing this as safely as we can.
Great. And all of that is, I would just remind people that all of that is in our protocols document. And so to read through the section on test and stay, which does describe that policy. Okay, so Rob, these next questions are for you in regards to the attestation form, and there are some questions about reporting positive cases. So the first one is any guidance you have for buildings that have both a middle school and high school, or even a pre-K housed within the high school, and how they should calculate the 80%.
Yeah, thanks, Lauren. Good morning, everybody. Our inclination right now, as the policy document said, is to think about the 80% at the building level, regardless of the grades that are in there, regardless if it's a middle high school and there are middle grades and high school grades, what have you. Our inclination is, as the document says, to think about it at the building level and have to be 80% of students and staff within the physical structure of the building. That being said, I have had several conversations with superintendents about, different circumstances that exist. and would welcome the opportunity to hear from superintendents if there are specific situations that they'd like to talk about. I would urge that they reach out to me and we can have a phone call just so I can understand the specific circumstances. But the general answer is that the calculation needs to be at the building structure level.
Great. And people are wondering how schools should enforce unvaccinated individuals wearing their masks, and whether or not the department will be providing any guidance on this in the future.
So once I'm assuming this means once we lift the attestation, or once we lift the mask mandate after an attestation, if we were to do that for a school, if there are students who are still required to wear a mask because they are unvaccinated, what's the enforcement look like?
Correct. Yes. Thank you.
Right. Yeah. So I think that's something that we'll need to address as we get closer to the 15th and actually lifting the mask mandate for a school. So I think there needs to be more. I think the best answer is more info to come there.
Great. And then this question actually relates to reporting positive cases. Can you just review which cases need to be reported to the department, especially the ones that are all of the cases that are being administered in school? Do they also then need to be reported to the department?
Yes. So we're requiring districts to report all individualized positive cases to us on a weekly basis. So that does not include pooled testing results. Only the individualized positive COVID-19 case results need to be reported to the department.
Great.
Lauren, I'm just going to chime in there really quickly while we're talking about data and reporting, because it's something that we actually should probably just start putting in our slides going forward. But we're also this week, for this week, we actually started reporting out from our K-12 testing program, and there's some great news in it. And I'm just going to share it on the screen real quick, just so that you can all see it. Because I know I got a question in my chat about what is available publicly. And so I just want to share this with you right now. This is Rob's good work, and also from Jeremiah and Sean on the CIC team, all coming together to have this in one place for you. And so, what you were just talking about is reporting the positive cases to us. Note that starting this week, we've got K-12 testing data, and of particular note, and really maybe just a huge shout out to all of you for the work that you've done to implement Test and Stay. But we can see that the number of in-person school days saved this year through Test and Stay, the number of negative tests is 9,011. That's amazing. 9,011 days of learning that we have been able to maintain collectively. And I know that number will continue to grow. But if you have questions about what is available publicly, it's on our COVID-19 webpage. Under positive COVID-19 cases in school on the left-hand side of the screen. Again, positive COVID-19 cases in school. We provide an updated spreadsheet every Thursday, so that this information will come out every week. We'll keep adding to that number every week. And I think it's also important to note that the pool positivity rate for the program total since the beginning of the school year is 0.91. So still a very low positivity rate in our schools. Jeremy, I don't know if there's anything more that you'd want to say about the data.
Yeah. Thank you, Russell. Two things I want to say about it. I know you already said thank you to Sean, but this is literally, it's been a labor of love and it's been since I want to thank Sean on our team. And the second thing is, one thing that some of you may have noticed already that's new to this reporting, because we did reporting that was obviously not as detailed as this and did not include Test and Stay in the spring, is that there's district level pooled testing information. And so Russell, if you could just go to the second tab over there, district COVID cases, great. And so this will show for the last week, for the week of the report, both the positive cases and also the number of pooled tests that were run that week, and positives and positive rate. So that's now publicly available, but maybe a good record for folks. I'm sure you all have it, but it'll be kept in one place.
Great. And we'll just make sure we lead with that more in the future as well, just to keep people focused on the outcomes, because that's what this is all about. And so appreciated the questions that that helped to trigger that, and appreciate all the work that it's done to get these data reports together.
Okay, Russell, I think that's it. We will post these slides on our website, and feel free to email the K-12 testing mailbox or Rob Curtin if any other questions come up.
Great. Thanks so much, everyone. Have a great rest of the day.